Hi everyone, thanks for joining us. Today's video is to hopefully help parents who have children dealing with nosebleeds. So first I want to reassure you that nosebleeds are very common in children, and we'll talk about why. But as always, I also want to remind you that this is general medical advice, and if you have specific questions about your individual child, you should call your pediatrician. Well, the reason nosebleeds are so common is because the nose is so very vascularized. That means it has a lot of blood vessels. And this serves two purposes primarily: to humidify and to warm the air when we breathe through our nose. And to accomplish that, you have to have a lot of blood flow in there. So imagine the lining of the nose sort of like this very, very thin layer of saran wrap. Right? And then behind that thin layer, there are these huge, juicy blood vessels. Well, anything that causes a crack in that thin layer can make a nosebleed happen, or anything that causes increased congestion in the nose, in the blood vessels of the nose, are going to make the nosebleeds more common as well. So the most common cause of nosebleeds in children is digital trauma. So imagine that thin saran wrap layer. If the nail accidentally makes a tiny slice in that, there can be a large amount of blood. And the problem is that once the nosebleed stops and there's a scab, the scab is itchy. And so the child can't help but rub it or scratch at it, sometimes even in their sleep. So I know we before have had a child to wake up in the morning with a lot of blood on their pillow, and it looks horrible. So when you do have a nosebleed, remember there's a lot of blood supply there. So there's going to be a lot of blood, and it's very scary, but don't panic. Also, don't do what everybody does in the movies. I don't know why they do this, but in the movies, they always hold their head back. That's stupid. Don't do that. That's just gonna make all the blood from the nosebleed drip down the back of the throat. Then the child's gonna swallow it. Well, it turns out blood is very irritating to the stomach, so then they're gonna throw it up, and then you're going to be dealing with vomiting blood, which is a true medical emergency if they were really vomiting blood, but really they're vomiting the swallowed blood from the nosebleed. So what you want to do instead of tilting the head back is hold it at a normal neutral position and just apply firm pressure right onto the middle of the nose. The blood vessels we were talking about are in the nasal septum, or that middle wall of the nose, and so you want to hold firm pressure there. This is how most kids do it. Most kids go pinch for about 2 seconds. Let's check to see if it's bleeding. Of course it's bleeding. No, pinch and hold for about 5 minutes. If that's not stopping the bleeding, then put an ice pack on their face, let them eat a popsicle. If you're using tissues or a washcloth, don't just keep switching it out, just keep piling on top of it, so hopefully it will clot. Now, if you have a child who's experiencing recurrent nosebleeds, which is common after the first big one to have those echoes of nosebleeds like we were saying because of the scab, then there are a few things you can try. You can try to humidify the air. Imagine if the air is dry, it's going to make that little lining of the nose crack easier. So you want to make sure you run a cool mist humidifier in your child's bedroom. You can have your child sleep with their head elevated at night because that will reduce the pressure. You can discourage them from blowing their nose too hard. You can apply a thin layer of Vaseline to that middle wall, that nasal septum. There's even a nasal saline gel called Air, AYR, and I know a lot of the ENT doctors recommend that to use for children with recurring nosebleeds. Now, as always, I want to give you a few red flags. If your child is having nosebleeds and any other sign of increased bleeding, that's an emergency and you need to be seen for that. So if your child is having nosebleeds and gum bleeds and blood in their urine and blood in their stool, or easy bruising or bleeding on their skin, or if you have a family history of a bleeding disorder, then you definitely need to be seen immediately. But if your child has some nosebleeds that always stop with firm pressure and always under 15 minutes of bleeding, then you're probably okay to treat this at home. Now, if you are doing all the right things, the Vaseline, the humidifier, the elevate the head, the pinch and hold, and your child's still having nosebleeds that last longer than 15 minutes or very frequent nosebleeds, the child definitely needs to be seen, and we need to check a complete blood count to make sure they're not anemic and to make sure they have a normal platelet count. And even if the nose bleeding is severe and long lasting, we will probably refer your child to an ear, nose, and throat surgeon who can do cautery of those bleeding blood vessels to help the bleeding stop. So I hope this has been helpful. It's very common in children. We get asked about this a lot. Children often have doctor's visits for this concern. So I hope this can help you guys at home to deal with nosebleeds. Thanks.